is stop being so fucking weird.
I fear I was one of those weird therapists. Hi, I'm Dr. Julia. I'm a licensed pediatric psychologist. I've been practicing independently for about 2.5 years now. Before that, I was on fellowship. Before that, I did my residency. Lots of different training experiences. And I would say I stopped being weird maybe on fellowship with still some weird traits sprinkled in. Unfortunately, or fortunately, I don't think it's my necessarily weird personality. I do think it was the way I was trained, which is the blank slate theory, which is basically that patients and clients should know nothing about you, which made for some really interesting interactions when I was a therapist in training and terrified of doing anything unethical or wrong. I still cringe when I think about this story, but the good news is that me and this client still had a good, positive relationship afterwards, and I hope she's doing well. But I was in my second year of my PhD program, which means I was my first year of doing clinical practice, and I was working with young adults with anxiety, depression, trauma. So it's kind of more of a community mental health setting. And I had this wonderful young woman I was working with, and we were doing some trauma work, and she was fantastic. She was very engaged. We had a really positive relationship, in my opinion. So proof that I'm not weird all the time. But when it came to like wrapping up our work together, she, again, the context was that there was a history of trauma, and don't want to go into too more detail, but she goes, "Can I hug you?" at the end, and normally I'd be like, "Yeah, of course," but I was such a paranoid little therapist. I was so scared of doing something unethical or wrong, especially in the context of her having a history of trauma. So I asked her, the client, what my supervisor, because I was supervised by a student a year ahead of me in the program, what they said about this. I panicked. And I knew that they still did some work together. They were doing some, I can't remember how we split it up, but we were doing 2 different types of like interventions for the different types of concerns she was having. Anyway, and she goes, "Oh, well, blah, 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 Laura, this other therapist said that as long as you're okay with it, it's okay. It's not unethical." I'm like, okay. So yes, I asked my client what my supervisor would potentially say, or supervisor, she wasn't my licensed supervisor, say about hugging. We did hug. It was totally fine. It was very appropriate, and we still maintained a therapeutic alliance, and now we can probably laugh about it. I don't even know if she remembers this. This was like a while ago, but anyway, there's hope for us all. I don't do that anymore.